With 6th season in full gear, I decided to create a video with a live demonstration of how to administer a breathing treatment. I'll go over the parts, how to dispense the medications, and reasons for use. But before we dive in, if you're new to my channel, welcome. My name is Christina, nurse practitioner. Don't forget to subscribe and hit that notification bell. Let's get started. Reasons for use of a breathing treatment would be indicated in the setting of wheezing, or if your patient has a working diagnosis of croup, commonly seen in a pediatric setting, or with an upper respiratory infection complicated by asthma, or can be in the setting of pneumonia. These are the parts of the nebulizer. This includes your mouthpiece or face mask for single use only. This can also be attached to a patient's trach, so the mouthpiece, which is attached to the nebulizer that attaches to the medicine cup where you will dispense your medication inside, which is liquid form with a volume size of about 3 ml. Make sure you secure the device closed, which will attach to the hose or tubing that will connect to your machine, also known as the compressor. You can then apply this to your patient for administration.
Yes!
The route of the medication is dispensed through inhalation through a mist that is inhaled into the patient's lungs. If your child is crying, even better. This will surely ensure adequate administration. Anytime you administer a medication via inhalation route, you will verify the 6 rights of safe medication administration. The medication dispensed are dosed based on the patient's size and will be labeled at the top of the vial. For example, an albuterol treatment can be dosed at 0.63 milligrams per 3 ml for a younger baby, or 1.25 milligrams per 3 ml for a toddler or 2-year-old child, or 2.5 milligrams per 3 ml for an adult patient. The medication will be referred to as a neb, and some nebs can be referred to as duo nebs, meaning there are combo meds. So for example, it can be combined medications such as Atrovent and albuterol depending on the patient's needs. A little housekeeping: depending on your setting, it can be dispensed by a registered nurse or a respiratory therapist in a hospital setting. This also includes the emergency room. Otherwise, can be dispensed by a nurse in an outpatient setting. To have access to this medication at home, it actually requires a prescription for the medication and compressor at home by your medical provider, which has been my saving grace with young toddlers at home. Some of the side effects of albuterol can cause tachycardia, so in the setting of fever, the heart rate may be elevated, so be cautious because fever can also cause a higher heart rate. It is typically dispensed and labeled 1 neb every 4 to 6 hours as needed for cough. All right, my friends, I hope you found this video helpful. If you're looking for more content on oxygen therapies, check out my video linked in description box below that covers all the content on different types of oxygen, and I'll catch you on the next one. Take care.